So the rehab center, you have different types of patients coming into a rehab center. So if somebody is not well enough to go home, they'll typically go to a rehab center. So if it's orthopedic injury, or it's somebody that's had, both their knees replaced, both, a hip replaced and something else, then they can't go home. They'll go to a rehab center. You also have people who have brain injuries. So somebody that has a brain injury might not be able to take care of themselves. They need to learn how to function again. There's also spinal cord injuries, amputations, strokes, and then people who have other disabilities, debilitating diseases. There's multiple sclerosis is one, which is MS, Parkinson's. These are all diseases that can affect your ability to move. So in a rehab center, you see the patients a lot more. So in certain rehab centers, you are seeing a patient, they have to have therapy for 3 hours a day. The therapy could include occupational therapy, speech therapy, or physical therapy. So they're having a lot of therapy. The goal is to get them functioning, to get them home, and that's why they're there, is for the therapies. And so then the other kind of
so they have a bed to stay in there.
Right. So they have a bed, and then they have meals and everything there. And the main reason they're there is for rehab, to make them safe to go home. And so people that can't tolerate 3 hours of therapy will go to what we call a subacute facility, which a lot of times are associated with nursing homes. So somebody that might be either typically elderly, or they just have a lot of stuff going on, they cannot handle 3 hours of therapy, they'll go to a subacute. They'll still have all the same disciplines: physical, occupational, and speech therapy. And again, the ultimate goal is to get them to go home safely. Okay. So the next one is probably where I've worked the most. That's in outpatient clinics. And typically, if anybody's ever had an injury, this is probably where you've gone, is to a clinic. Orthopedic is kind of more general. It covers.
Can't hear you. Lucy, we're not hearing you. Can you hear me?
Is it possible that maybe Lucy's phone died?
No, it's still alive.
Oh, we hear you.
There.
Okay, you hear me now?
Yep.
All right. Sorry about that. So the other one, the sports medicine, is sort of more like a subtype. It's basically like what it sounds. You're working with athletes. So you're working the higher functioning levels, a lot more specific. You're trying to train the whole body as well as the injured part to get them back to their sport. And so it's a lot of specific training within that sport. Neurological has to do with typically, I'll see Parkinson's patients, MS patients I've seen. I've seen people who have had strokes, typically in an outpatient clinic, unless it's a neuro clinic. I would see more high-level stroke patients, just because we don't have the equipment to handle patients that are really debilitated. Women's health is a specialty that I never worked with. It has a lot to do with training the abdominal floor. So a lot of times women who've had multiple childbirths or surgery, it's trying to strengthen the pelvic floor to help them to be able to, function better. Okay.